penalties for offenders has intensified. Should drug counterfeiting be considered as serious as violent crimes like murder? Would a death penalty be an effective deterrent?
And so to help us unpack this, we're joined by two guests. Our very first is Dr. Philip Njemanze. He's the chairman of the International Institute of Advanced Research and Training, Chidi Khan Medical Center. And he joins us live. Also joining us is Seumbur Iyange. She's a legal practitioner. She will help us to understand the legal and human rights implications of this proposed penalty. Ladies and gentlemen, thank you so much for joining us.
Thank you for having me.
Let's start with you, Dr. Njemanze, shall we? Fake and counterfeit drugs pose a major health risk, but often leading to treatment failures as well, drug resistance, and even death. From your perspective as a healthcare professional as yourself, why does a case of fake and counterfeit drug still persist in Nigeria?
Yes, actually, when you look at the problem, and you have to look at it holistically, while we have the NAFDAC, and I must say here that they are doing tremendous work, very, very good work and important work. You look at it from the point of view of the legal framework protecting people from fake drugs. And this is grossly inadequate. And when you look at the whole holistic problem, you'll see it from the point of view that even though they try to control the inflow of drugs, how does this drug legally get dispensed to the end user, the patient? There is no legal framework for this. It's almost like free for all a market whereby there is no profession that should be strictly medical that has the prescription right. The prescription right is that somebody has to say that this drug is appropriate and I'm prescribing it for this purpose in this patient under these conditions. So since we do not have a comprehensive prescription rights law, that makes it very, very difficult to control who is in charge of this. Is it the drug dispenser, the peddler, the pharmacist, or the doctor? Who is really in charge? Quite frankly, nobody is in charge. Once you do not have a comprehensive prescription rights law. So that's one thing that needs to be done. And when we think about this, we must think about it holistically. Why are we still importing a lot of drugs? And this is where the fake drugs come in. Because it is profitable for the people to just bring in these drugs, even though they are fake, and sell them. But if we had a functional and real supported pharmaceutical industry, that means, what I mean by this is that you provide at least a 200 billion naira loan in our budget for health bank, in which the people who are in drug manufacturing can borrow money at single digit interest loan. So let's say for example, 5%. And they borrowed, let's say, 10 billion or 20 billion to produce a certain drug. And this drug is being produced in Nigeria. The quality is being checked by NAFDAC, and it is brought into the market. It will be very difficult for people to go to India or China or anywhere else to forge these drugs and bring them in, because they are already at a very reasonable cost, and their profit margins will be almost non-existent. So you have to take a comprehensive approach.
Now, I see what you're saying. They produce them here in Nigeria, give people jobs, and also check the standards. But then again, that's also perhaps could result into, well, there's certain areas that if left unchecked could result into a bigger problem. Now, that's me I'm not a health professional, you are. So I'll take your word for it. However, now let's look at the claims of death threats by the DG of the NAFDAC and also some NAFDAC operators there. They said that their lives have been threatened because of the crackdown that they are undertaking to make sure that we get proper drugs. Now, she's also called for the death penalty for violators, people who peddle these fake drugs or people who even manufacture them or even import them into the country. We had a conversation on Thursday, if I'm not mistaken, where you noted that perhaps maybe it is not the best idea to put a death penalty to this. Do you want to take us through that? You have plenty of time now to explain why the death penalty might not be the best way to go in this case.
Yes, first of all, I must say that NAFDAC is doing wonderful work, and I commend the President Director and his staff and her staff on what they are doing. And we commend this. They are doing very brave work, and they need support of the Nigerian people and the Nigerian government and the whole law enforcement structure in this country to accomplish their task. We need to protect these staff of NAFDAC in every way possible. However, would it mean that if we impose that sentence on drug peddlers and we will not have a stricter enforcement? That is very doubtful, because we have done that before. We have done that with kidnapping. Well, what has happened now? Not only has the ransom increased tremendously, they now kill, even after the ransom is paid, they now kill their victims. Now, we did that with armed robbery. It only got deadlier. And, you know, people were even talking about rape and all that, imposing the death sentence. They were now burning all their victims. So really, the experience in this death sentence issues does not really suggest in any way that will make the crime less. No, most times it makes it even more deadly. So I think the problem here is that once the person who is peddling the drug is looking for money, looking for profits where he doesn't deserve one, by deception. So what you have to do is to use the market forces, as I said before. If you make it unprofitable for people to bring in fake drugs, it will not be an encouraging trend. You see, people only peddle drugs like fentanyl, tramadol, and all that because there are people buying them. Now, but if you were to institute treatment facilities, look at it, in this state now, there are barely 1 or 2 treatment facilities for drug users. There is virtually no education on the dangers of use of illicit drugs. So really, we are not doing the structural needful things that we need to do to make sure we discourage the practice. We are strictly taking a law enforcement approach, which, well, regrettably doesn't work very well.
And so then what then should now be the alternative? Is it financial punishment, longer prison sentence, financial penalties? What there should there be? Because the crackdowns didn't just start now. It started as far back as the 90s with Dora, the former DG, Dora Konyili, who doubled down on crackdowns on counterfeit drugs and fake drugs. Should it be longer prison terms? Should it be life sentence in jail? Should it be financial penalties?
Yeah, I think the NAFDAC director, when I heard her comments, was very correct in saying there are so many ridiculous sentences that are there. 250,000 fine and 2 to 3 years imprisonment.
Right.
They has no place. She's absolutely right. Those sentences should be much more severe. But I wouldn't be one of those who will subscribe to death sentences as a panacea for dealing with dangerous crimes. No, I think we should take a different approach in that regard. We can impose 10-year sentences, 14-year sentences, depending on the severity and the implication of what has been committed. However, the death sentence should be a rare event which we impose in our legal structure, not just for drugs, but even for every other thing. It should be an extraordinarily rare punishment to impose, if at all. The reason for doing this is that when somebody thinks, I'm going to be all my life in prison, I mean, without it, it's even more punishing that he's going to die in 5 minutes. So that's just the psychology of it. So, and once we look at this from that perspective of imposing even long-term jail sentences, and then, of course, confiscating all their properties and all that, that is far more effective than the death sentence.
I would say that their efforts to, for the proliferation of counterfeit drugs, it has doubled in over time. It's doubled down. We understand that our legal practitioner, Seumbur Iyange, she joins us now. Hi, and good morning to you, ma'am. Good morning. We're still having issues with your audio. Good morning. Can you hear us?
Good morning.
There we go. Fantastic. The doctor is of the opinion that a death sentence is very harsh. You are a legal practitioner here, so let's take this from a legal, lens. Is this fair when you think about the human? Does this hinder on your human rights privileges for death sentence? Because the argument is that the persons who proliferate counterfeit drugs are committing mass murder. Your take?
Yes, my take on that. Thank you very much. Under the Nigerian legal system, the death penalty is still legal under the criminal code and the penal code for certain crimes such as murder, armed robbery, terrorism. Now the question remains whether counterfeit drugs can be equated with mass murder. Well, to the best of my knowledge and my understanding, counterfeit drugs indeed, they cause mass harm to the healthcare system and leading to loss of lives, and on a large scale, especially when we are dealing with life-saving medication. However, to apply the death sentence, it will have to go through the requirements of the law, and it will have to be through very strict legal reviews. And our current laws do not provide for the death penalty for peddling in counterfeit drugs. So while there may be mass murders and while the death penalty may sound, while it may sound as an effective way, our laws do not provide for it. And then we look at it in the international context as well. On the international stage, we have the use of the death penalty is heavily scrutinized, and many countries have abolished the use of the death penalty. We have international instruments like the International Convention on Civil and Political Rights, which Nigeria is a signatory to, that permits the use of the death penalty.
We're having issues with her connectivity there. Our legal practitioner just giving us a bit of insight on the call for brain fart.
It's okay, I'll help you out there. Let's turn to Dr. Njemanze back again. Now, doctor, we can be our own saviors if we put in a little bit of our own effort. How can community effort help? What do we need to do as a people who are actually the consumers of these fake drugs in the end? What must we do, or how can the community help? Community participation, let's put it so.
Yes, I think we need a little more activism in terms of education. The NAFDAC has a structure of reporting, and I think that has to be strengthened. So the community should serve as the ears and eyes of NAFDAC. So people should have direct access to NAFDAC by making their reports in a very confidential and protected way. And I think the structure which NAFDAC has put in place has to be made aware to the people, so they will know actually what NAFDAC can actually be duly informed about what is happening in the community. The other aspect of it is that you have to educate the community, because the community has gotten used to the fact that if they are sick of malaria or whatever they think it is, even if it's not malaria, they just go out to the chemist and pick up some drug. There is no structure of going. There is this culture that is not really there, that you have to go to the doctor, get a prescription, and then before you go to the pharmacy. So we really have to re-educate the Nigerian populace and tell them this is the proper thing to do, not because you're going to give money to the doctor, but to make sure that the drug you're taking is appropriate for the disease that you want to get cured of. So there has to be a re-education of the Nigerian populace to empower them so that they know the right structure and the right application of drugs. So I think in all, one can also say that we have a very big ungoverned space as far as drug administration is concerned. NAFDAC is only controlling the medication, which is only about maybe in 30% application of use in the country. So you have 70% who are using traditional drugs. They use all manner of herbs that are bottled, whether they are fake or anything. Who does that? Who will control that aspect of? Because that kills far more people, causes far more complications than that. So we, as I said, the legislature, the Nigerian National Assembly has to take a comprehensive look. So that if you allow a large ungoverned space, like not having a control for the herbal drugs and traditional drugs, you are actually moving people. When you start imposing a strict control of the medication, you are just moving them over, because they will still get sick. So they will just move over to the ungoverned space. So that is why you must take a comprehensive approach. So as you are creating for medications NAFDAC, you are also creating another structure to handle the traditional medicine, which is equally as effective. And you have to have a national pharmacopoeia so people will really know what is in the traditional drug and what does it do. So this is not something you just do by legislation and passing death sentence and it's where all things will be taken care of.
All right. I mean, Doctor, earlier you're talking about, how we can provide single digit.
So you have to.
All right, I was saying that earlier you were talking about how businesses, or should I say financial institutions, can provide single-digit loans to manufacturers, medical manufacturers, to be able to provide, to create, manufacture drugs in Nigeria, giving the inflation and the economic downturn that we find ourselves, the cost of living crisis. I want you to speak on that, because you are not just a medical doctor, you're also in the pharmaceutical end in terms of laboratory and the rest. And so I think you kind of get a clear understanding of what is it like and what's the red taping, or should I say the hoops that one has to jump to even get a loan from these financial institutions. Dr. Njemanze.
The private practitioners, yes, please.
Yes. Yeah, go ahead.
Yes.
We didn't hear you.
Private practitioners, the private practitioners in this country, under the aegis of the Association of Private Medical Practitioners of Nigeria, has been advocating this for almost 30 years. In fact, as a member of this organization and a member of served in several committees of this organization and chairman of Imo State for some time, we have advocated that, look, you need a health bank, just like you have agricultural bank. You need a health bank, where if you don't want to give grants, which you should have a single-digit interest loan for establishment of hospitals, establishment of the pharmaceutical industries, and the establishment of any health facility that gives social health services. So once you have that, then maybe up to 200 billion is issued every year in terms of loan. You are going to see excellent pharmaceutical companies spring up in this country, manufacturing standardized drugs, which people will now take and get well. So we don't have to depend on America or China or India or elsewhere. So we get these drugs, they make it and tablet it in this country, and they will be sold for much less, because there will be no need for any importations and all the tariffs that has to go with importation of things. Now, we have the raw materials here, so we can now also buttress the indigenous use of raw materials from all our enormous reserve of raw materials in this country as natural compounds. So I think the thing has to be done in a very fundamental. The government of President Bola Ahmed Tinubu can take this initiative and say, okay, wait a minute. Let us bring out the first 200 billion, which we are going to give to the health sector, and establish a health bank. Go there, borrow money, and then do the improvement. And we make sure we are watching you, because you're just in this country. NAFDAC will have a direct access to approve this stuff and make sure that all the things are standardized. And so I think if we take this approach, we might not, the days of big drugs in this country will be numbered.
Dr. Njemanze, you have been sublime. I want to say thank you for taking out the time to join us today to just give a bit of insight on all of this.